It's really helped our health department, which is a rural health department with about 100,000 population. And it's helped us in a number of ways. I'll list a couple. First was we were able to hire some new people, particularly health equity coordinator, and to do more development around our internal workforce in public health. And third was to help us really establish a better brand for our public health department. And the brand was important because coming out of COVID, there was a lot of dislike and concerns about public health, and so we wanted to change our image. So those are three areas that we've used our resources for, and it's been very helpful because most of our resources in public health, as most public health people know, are categorical and don't allow for some of these kinds of things that are really essential to build a workforce, but also to rethink the public health system in our county. We had our county logos and things like that, but we never really had an identity as a department. We're working right now on vision, mission, values to bring the staff together to kind of rethink our purpose as a public health department. Our brand that we created, it's called We Care, and it's really exciting because it's got a little heart and little people and different kinds of designs. But it's really, we care about the community, we care about moms, we care about families. So we use the We Care to really talk about the communities that we serve. So I mentioned we're going to be working on our mission, vision, values, which we did about 8 or 9 years ago, and refreshing those in the context now of, I call it the post-COVID world, and in the context of, as we talked about, issues around poverty, living in a rural community, our identity as We Care, and trying to figure out ways that we can improve upon our overall health department status and the work we do, expanding some of the work we do in communities, and really trying to go where the people are instead of being in our offices. And so we're embarking on a lot of community outreach clinics and events and things like that where we go with our public health staff and our expertise and provide all kinds of services, but also with that brand, and now with kind of a better understanding, I think, as public health practitioners about the importance of how we come to the table, if you will, when we're meeting with clients and working with our partners.